The top 5 points that you should consider while selecting a dental software for your practice. The point number 1 is the software should be user friendly and easy to use. Imagine you have selected a software which is little complex. You may be spending a lot of time to understand the software, give training to your staff, and you may be spending a lot of time to make the data entry into the software. So it is very difficult to use such kind of a software. So the first consideration should be the software should be easy to use and it is user friendly. Point number 2, features. Before selecting the software, try to understand your requirements. If you have a very good setup, then probably you can computerize everything. You can computerize your workflow, you can computerize your inventory, pharmacy, orthodontics, expense, lab works. So try to get a software which is having all these features. There is no point in spending too much money into the software unless you really require it. Point number 3, the technology. Before selecting the software, try to do enough research on the technology what they are using. There are softwares which is using the technology which is 5 years old or 10 years old. So you should always select the software which is using the latest technology. It can be a web-based technology, it can be a mobile-based technology. Point number 4, the support. This is probably the most important point among all these 5 points. Imagine you selected a software, you run it for 2 years, and one day you find the software is not working. You will try to contact this vendor. The vendor may say that, I closed down my operations, I'm no more into this business. Then it is a panic situation. The entire data that you entered for last 2 years, it's all there in the software and the software is not working, the data is lost. So that is a very panic situation. So the best method or the best approach to handle this is to select the software from a non-vendor or a vendor who is having a very good track record. Point number 5, the pricing. I kept this as my last point because you should give a low priority to this point. You should always give priority to the other 4 points that we discussed. Normally, the dental softwares are available in 2 models. It is available on an on-premise offline model or online cloud model. The offline software can be available in a subscription model and as a one-time payment model. Whereas in the case of online, it is available only on a subscription model. If someone is saying that I can give you an online software at one-time payment, don't believe that, because the vendor is paying to the hosting company on every month basis or on a yearly basis. So they cannot make the software as a one-time payment in the case of online. If you like our video, give us a thumbs up and don't forget to subscribe for the channel.